Okay, please just let me know if you can see my screen. I'm sorry about the network issues that we're having.
Okay, yes, you can go ahead. We can see you, but we can't see your screen.
Can you see my screen now?
Yes, we can.
Okay, so this is what I'm going to be presenting on hypertension and food and addressing the unseen connection that a lot of us probably don't understand or recognize. I'll start off by just talking about very briefly what the heart is, and it's basically a muscle that's about the size of a closed fist. It's one of its functions is the movement of deoxygenated and oxygenated blood to and from the lungs. It has other functions, but that's the only one I would highlight today. And hypertension is basically when there is an increase in the blood pressure. Blood pressure is the force or the pressure that is needed to move blood through the arteries. So knowing if a person has hypertension is when there is an increase in either in the systolic and the diastolic pressure or one of the two. So systolic is basically the first pressure, the one that is seen if you check your blood pressure at home, it's the first figure or the one on top. And that measures the pressure of the heart when it's beating or working. Diastolic is basically the pressure when it is at rest. So when the blood pressure is higher than 120/80, you are said to be, the person is said to be hypertensive or is having hypertensive heart disease or elevated high blood pressure. Now, there are basically no signs to tell when a person is hypertensive or is about to crash. However, when there are slight elevations in the blood pressure, yes, there are some classical signs that are seen. And the reason why we call it the silent killer is that these signs or these symptoms are often misinterpreted or seen as other things. For instance, headaches or visual problems. Sometimes we have headaches and we say, oh, I've been staring at my screen too much, or I'm stressed out, that is why I'm having headaches. We would mostly not check our blood pressure, or then there's chest pain, proteinuria, and a couple of other things. These are just more symptoms that we have. Fatigue and the likes are other things. It's one of the top killers or one of the leading deaths or one of the leading concerns globally, basically. So this chart just lets us understand more about the figures that we see when we measure our blood pressure. So some risk factors that predispose a person to hypertension. Now, they are grouped into two, non-modifiable and modifiable. They are non-modifiable because you really can't do anything about it. For instance, your age. You can't do anything about your age, your genetic factor, or your ethnicity. But those are some things that can attribute to a person's ability to develop or come up. Unhealthy diet are modifiable. Being obese is actually known to be one of the leading causes of hypertension, as well as lack of physical activity and the rise in smoking. But we'll get to that as we go on. Are just complications that come up with diabetes because now the management of diabetes, of hypertension, I'm so sorry, can be done with eating a healthy diet, exercising regularly, maintaining a healthy weight, limiting alcohol consumption, and then monitoring your blood pressure. So these are the 8 ways or the 8 leading ways of managing hypertension. Now this is my area, diet and hypertension, if there really is a connection. So research over time has shown that changes to your lifestyle habits or dietary habits can help and delay the onset of high blood pressure. Now, it is delay or prevent because if, for instance, you are in a family where hypertension is seen to be prevalent from generation to generation, the term that you use in that is to delay the onset because you are more prone to becoming hypertensive. And then you can also prevent it. Now, in addition to that, a healthy weight, avoiding or limiting tobacco use, same for alcohol, can have a positive impact on the blood pressure. Also, physical activities of about 45 minutes per day is recommended. Now, when we're talking about hypertension, one nutrient that we always look at is sodium. And the dietary source of sodium, or the most common dietary source of sodium, is salt. Salt is predominantly made up of sodium chloride. Now, for people that are trying or making sure that they don't develop hypertension, it's recommended that they get about 2,300 milligrams of sodium maximum per day. And for those that are already at risk or already have hypertension, about 1,500 milligrams of sodium is recommended per day. So there are some questions that I get frequently when I speak to people about hypertension and their diet and if they can become hypertensive. And I just highlighted the top two. And then one of it is that, can what I eat or what is being eaten predispose you to that hypertension? The answer to that is yes, it can, and it will actually. And it's even higher or it's worse for people that have strong family history of hypertension, like I said earlier. And then the other one that I get a lot is alcohol, especially red wine. Is it essential for a healthy heart? Or can I drink alcohol and red wine at least a glass per meal to reduce my chances of becoming hypertension? Truth is, the thing in alcohol that makes it healthy or good for the heart is the grape that is used to make this alcohol. It has some nutrients in it that are beneficial to the heart, but the alcohol content of this red wine itself is dangerous or hazardous to the body, and the body actually does understand it or break it down as it would poison. Now, in cases where a person just must have alcohol, we recommend 2 standard glasses or 2 drinks per day for a man, and 1 drink or 1 standard glass for a woman. Now, we also notice that in recent times, the rise in the prevalence of hypertension seems to be on the high side or seems to be increasing. And this is because there's been an increase in the amount of fast food that we eat, in the amount of processed and pre-cooked meals that we eat, in the amount of saturated fat that we consume, in the amount of trans fat that we eat. Also, our method of food preparation has also deteriorated as time has gone on. So that's something that has caused the rise. And soda consumption, increase in caffeine, increase in alcohol intake is also something that has come up. Because there's an excess of all these things, people have also been seen to become overweight or obese. That also affects the heart. So I just went on to list out some common foods that we eat and their sodium content. Now, bear in mind that I said earlier that the amount of sodium that a hypertensive person is allowed to take per day is 1,500, and the amount of sodium that a person is allowed to take that is not hypertensive is 2,300. Now, in your instant noodles, in 170 grams pack of instant noodles, you have about 1,180 to 1,240. The most common ones have 1,240 milligrams in 1 pack. That is in just the noodle. Now, most times we don't just take 1 pack because this 70 grams pack is the small one. You take 2 of that. So by the time you have 2 of that, you've already taken in 2,480 milligrams. That is excluding whatever you're going to add to it. Now, there are other factors that can also cause hypertension. For instance, the amount of saturated fat. This gives you about, for this instant noodles, you get 35% of that. In the entire day, I put that at the bottom. The amount of saturated fat that you should get should be 6% of your daily calories. Now, you're already getting most of it from just 70 grams of instant noodles, where you would probably eat 2 or 3. Aside another thing that we eat, other things that we eat a lot of, especially with our noodles. So if you're going to have instant noodles and let's say a sausage, so in 1 sausage roll or in 100 grams of sausage roll, you have 731 milligrams. If you do the math, you've already exceeded the amount of sodium that you should get, and this is probably taken as a snack. From beef that we just have and add to our meals, and we've already added a lot of salt to or seasoning to, has 550 milligrams per 59 grams. From our food, we take things like soy sauce to stand in the gap for these things, and these things as well are very, 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 they have an amazing amount of sodium in it as well. So when we say take away salt from your food, we don't mean save and replace with things that are also abundant in sodium chloride, because they have an adverse effect on the heart. We mean all the food sources or all the seasoning sources that can give or that can increase the amount of sodium that you get in a day should not exceed 2,300 or 1,500. And from using these three examples, you can see that we always exceed this unknowingly anyway. Now, the next question I always get is, oh, can I have caffeine? Seeing that, knowing that I have hypertension, oh, caffeine is good for the heart, it keeps me awake. Now, the amount of caffeine that you should take if you have a strong family history of hypertension is 200 milligrams. If you do not have a strong family history of hypertension, you should get about, or you can get about 400 milligrams per day. In 16 hours, in a 16 hours cup of coffee, you get about 330 milligrams. So you've already exceeded that. In your regular energy drink, you get 160 milligrams. In your bottle of Coke or whatever soft drink that has caffeine in it, this is the amount of caffeine that you get. This just further breaks it down for us to see. So when we say things that are decaffeinated, like decaffeinated tea, we don't mean that the caffeine has been taken out totally, but the amount of caffeine in that tea or coffee is so negligible that you can have your 8 cups that you normally have, and there will not be a spike in the amount of caffeine in your system and then cause a problem. So we've talked a lot about what you should not do, or a few things that you should not do. So let's talk about the things that you can do. You can do to help your sodium content. So one nutrient, or I'll mention just a few of the nutrients that you can have. The pyramid is just to show you things that, so from the bottom up, it shows you the abundant things that you can have, and it narrows it down, to the least abundant thing that you can have. So the things that you can have in abundance are your fruits and your vegetables. Why? Because they have, amongst other things, a nutrient in it called potassium. Now, potassium actually helps to balance out sodium in the body and helps to regulate the body water balance. So an increase in the amount of, an increase in the amount of potassium, causes a decline in the amount of sodium, thereby causing a better blood pressure reading. So if you have fruits and vegetables that are abundant in potassium, for instance, the amount of sodium moving around your body and absorbing water will go down. Then in turn, you'll have a positive impact or effect on your blood pressure because it's not holding so much fluid anymore. Same thing for your fruits as well. Now, another nutrient that you can, and you should have a lot of, is calcium. For calcium, you can have about 1,300 milligrams per day. And apart from calcium's ability to strengthen the bones, it also is strength of the heart and enables it to function better. So you can have things that are very, very abundant in calcium. You can eat any of these things on the pyramid. Now, going up, if you notice that spices are on, at the part for the spices, they begin to taper down because these things still have an amount of sodium in them. Supplements as well. And our classic red wine is seen to be at the top of this pyramid. So technically, having a glass of red wine per meal does not actually have a positive effect or impact on your blood. It doesn't. So the things at the top are things that you should eat as little, as minimal as you possibly can. So these are just essentials of a healthy heart, some of which I have already mentioned. There's a problem. Okay, yeah, so some of them I have already mentioned. So you should have whole grains, you should have more vitamins, more minerals, more omega-3 fatty acid as well. Now, another thing that we also would like to emphasize is the DASH diet. Now, the DASH diet is, so when a person is confirmed hypertensive or is suffering from elevated blood pressure, this is the diet that we usually give to them. And DASH diet is basically the dietary approach to stop hypertension. And you see that it comprises of everything that you would normally eat, but in a particular amount. It has lean meat, legumes, fat, low-fat dairy, fresh fruits, and grains. Now, the reason, sorry, why it is lean meat and low fat is because although fat is necessary for absorption of some nutrients and some vitamins, there are some kinds of fat that can actually cause a problem as it pertains to staying or reducing a person's chances of becoming hypertensive. Now, these fats are called saturated fatty acids. So saturated fats and trans fats and the likes are usually present in your meat. So a way around this is by eating lean meat, where they don't have this meat doesn't have this type of fat present in it. You can eat things like fish because those ones have omega-3 fatty acid that is good for the heart. And then you can eat things like avocado and the likes. Yes, avocado is in that. But things that have like palm oil, butter, things like that are things that you should limit, as well as your dairy products. So this is just explaining what I have said earlier. There are two types of the DASH diet: the standard, which is about 2,300 milligrams, and then the lower sodium DASH diet. That's usually for people with extreme cases. Now, the DASH diet, like I said, is abundant in fruits, scaly fish, vegetables, potassium, magnesium, and calcium, which are actually very healthy and very necessary in ensuring that you have a healthy heart. And then in the long run, it doesn't just help the blood pressure, it actually helps the cholesterol level. A spike in the cholesterol level can actually cause it. Now, there are other things that can cause a spike in the blood pressure. If, for instance, a person is suffering from a condition called atherosclerosis, and there's a narrowing of these arteries, that can increase the pressure, the blood pressure that is used to pump blood to or from the heart. So in conclusion, apart from the diet and everything that we have mentioned, a better working environment or a better working condition can actually improve the blood pressure, of employees. And it is possible to control high blood pressure through a healthy dietary lifestyle and general better lifestyle modifications. A modification to the diet is very essential in managing or preventing hypertension. Additional recommendations are made so if the blood pressure is uncontrollable, or if we see that a person is tending towards being hypertensive, modifications can be made. You can say, okay, increase your potassium intake, increase your calcium intake, and the likes. If alcohol must be consumed, it is advised that you stick within the prescribed amount, and if you can't do without it, please stay away from it. Another thing that I would like to mention that I omitted is that, yes, I know that we need to stay alert, especially in Lagos, where most people struggle out of the house or hurry out of the house, get to work and are tired. You really don't need to consume a lot of caffeine. If you can't do without caffeine, I recommend that you do. I look for other things to keep you awake, because in the long run, when you exceed the amount of caffeine that you should take, you can have a long-term complication that you may not be happy about. Thank you so much for listening. I hope I was able to address the topic well enough.
Okay, thank you, Mr. for the insightful presentation. You breezed through it quickly. I was trying to grab everything you said. I was just writing, and you breezed through it, but I was able to get a lot. And you answered some of my questions already, because I wrote down some frequently asked questions, and you were able to cover most of them. So now I'm thinking, what am I going to ask Mr. Oghan? But aside that, thanks again for the wonderful presentation. But besides that, I still have some questions. And from your explanation, you mentioned the DASH diet. Because it was one of my major questions. What should hypertensive patients, what shouldn't they eat? And you mentioned DASH diet. You said hypertensive patients should focus on fruits and vegetables. So there's this common question everybody asks. When we're talking about fruits, should we focus on fruit with less sugar? Should we focus on the cucumbers, the garden eggs, and leave the watermelon, the oranges, or all fruits and vegetables are good, because talking about that, we always say eat a lot of fruits and vegetables. So from a dietitian point of view, please explain and enlighten us.
Okay, so when we talk about fruits, I like to take people's minds away from the kind of sugar or the amount of sugar that fruit gives, because everything that we eat, apart from water, has sugar in it. Now, the kind of sugar that fruit has is actually okay if you don't have, for instance, glucose sensitivity or hypertension, or I'm sorry, diabetes or PCOS, or anything that will need to monitor your glucose intake. Now, what you should focus on is ensuring that you have the fruit whole. So if you're going to have an orange, eat it with the roughage that would usually be inside. How would you used to eat fruits as children when we peel it up and take it out? So you can have the watermelon, you can have the apple, you can have as you want. But what you can do is, instead of sitting down to finish a big bowl of watermelon and another big bowl of pawpaw and another, let moderation guide you. Now, we don't already get enough fiber, and a lot of things that are very abundant in fiber, like cabbage, garden egg, cucumbers, people don't like to eat them because they are bland. Now, other fruits that are sweeter also have fiber in them. So if you don't have any reason to watch the glucose that you're getting, yes, you can eat your fruits. But if you are dealing with something that, we need to watch your glucose intake, then we might want you to be careful. And then that a fruit is sweet doesn't exactly mean that it can directly affect your sugar level. What I mean is, some things are sweet, but the fiber content is high. So it mops up this excess glucose and helps to deal with it. And so there are other things to consider, really, but you can have all these other fruits if you don't have any reason to stay away from them.
Okay, thank you, Ms. Oghan. I think that was quite explanatory. So what you're trying to tell us is we should focus more on having a fruit salad rather than just taking 10 oranges in a sitting. So just mix your fruits with, you can have different types of fruit. So even if you have a sweet tooth, you can still taste something sweet while eating the others. Okay. At this point, I would like to say Dr. Folasade Alli, she's been trying to join us, but she's having issues, so she sends her apologies. She's yet to join us, but if she's able to during this webinar, she would speak to us. I'm sure a lot of us were really looking forward to engaging her and speaking with her, but apologies. And she's been trying to join. I think she has some connection issues. But we'll move on with Ms. Oghan. So while we are taking the questions and answers, please, if you have any questions, write them down in the chat box and we'll take your questions. And if you're, like I said earlier when we started, if you're shy about your question, you can make yourself anonymous and just put down your question. Ms. Oghan is here. She's ready to take all your answers, to take all your questions and give you answers. She's a licensed nutritionist and a dietitian. My second question is there any herbal mix that I know this is very funny, we hear this a lot. Some people, the first thing when you tell some people they have high blood pressure is, God forbid, they go to church, they pray, they do all that. Of course, we know these things are important, but and a lot of people sell some herbal mix, some concussions. They even have NAFDAC numbers on these things. You see adverts, and they say it cures hypertension, it cures diabetes, and all that. So, do you have any herbal mixtures, any certified herbal mixture, or any concoction that can reduce complications of hypertension? Do we have any herbal that can reduce complications or can reduce blood pressure itself? Please, I want you to enlighten us on these things people sell around. Thank you.
Okay, so as it pertains to herbal mixtures, no, because the thing with a lot of these herbal mixtures that they sell or that we have is that the downside outweighs whatever good side that it might have. Now, in these concoctions, one of the common things, okay, let's use yo-yo bitters, for instance. it has the ability to make a person purge. So it has an active ingredient in it that will make you purge. Or is it the ones that we are hawks on the streets? You don't know the amount. They don't measure. Okay, it's not like paracetamol that you can say, okay, paracetamol is made up of this, that in this quantity. The amount that the concussions or the things mixed used to make those things are not measured. And then in the long run, it can actually damage organs of the body that you need to help you. And one of the organs that it would, or that usually suffers for this thing, is the kidney, one of the many organs. So is there a herbal mixture? No. None that I would recommend, and none that any of my colleagues would recommend for hypertension. I hope that answers it.
Okay, thank you, Ms. Oghan. That makes so much sense. And really, we need to keep educating everybody, because there is just that strong conviction that, oh, when I drink this particular thing, this mixture that looks so black and bitter, it would help rejuvenate my body, it will cure malaria, it will, there's just that thing out there. I think constant education and enlightening people would really help spread the awareness. Okay, so right about now, Dr. Folasade Alli is with us now. I'm actually excited. And she's going to, Dr. Alli is going to be briefing us on hypertension and everything we need to know, the basic things we need to know. And after her brief talk, we are going to take some questions. And please, if you have questions, drop in the chat box. Once we are done, we will take all our questions. So over to you, Dr. Alli. Welcome. Okay, so I need to introduce her again because she wasn't here when I introduced her earlier. Dr. Alli is a consultant cardiologist and a cardiovascular researcher, and she's the chief of cardiology at Lagos Executive Cardiovascular Center, LECC. Some people call it LEC, some people call it LECC. So it's an honor to have you here, Dr. Alli. Thank you for joining us. Over to you now to give us a brief talk. Thank you.
What did you want me? Okay, that's it. Hello. Yes, please. We have. Hello. Good afternoon. No, with my phone.
Okay, hello, Dr. Alli. You have the floor now. I don't know if you heard me earlier when I introduced you, but you can go ahead and give us a brief talk on hypertension. Dr. Alli, can you hear me? Can you see me?
I can see you and I can hear you. Good afternoon.
Good afternoon,
Good afternoon to you. High blood pressure, as Ms. Oghan has said, I think she has said it all. She has made my work really very easy. And we've spoken about high blood pressure on several occasions. That this is one of the most highly well-recognized condition all over the world. But the problem we have here in Africa, and of course Nigeria being in Africa, is that majority of people who have elevated blood pressure, they are not aware of this condition. They are unaware. And for the certain percentage that are aware, only again another, a few people, a few percentage are treating it to target. There's a target to treat the blood pressure. So majority are not treating it well. They are not well treated, and therefore the complications are in multiples. And just as the dietitian, the nutritionist has said earlier, diet or what we eat is part of what is contributing to our disease states all over the world now. And people who live here, even in Nigeria, they want to eat like someone who is in the UK or is in America. So, importation of food, we imported the white man's feeding habits, and therefore we are already developing the disease of the white man. Before, in those days, it used to be that hypertension is rare in Africans, but now Africans has even superseded the Caucasians in development of high blood pressure. Not only in superseding in numbers, they've also even we Africans have also superseded in complications of this dastardly disease, simply because of our lifestyle. And part of that, our lifestyle, is the diet that Ms. Oghan has spoken about, the nutritionist has spoken about. I used to hear people saying, I don't know, can you hear me well, or do you want me to remove this face mask? Okay, maybe because there were more here, were many here. So you've heard, sometimes I have people say, I want to detox. I want to detox. After they have eaten, with their 10 fingers. Now, 1 day or 2 days in a year, they want to detox. And I'm like, who is fooling you? That is the story. Who is fooling who? You want to detox. You have been eating all kinds with your 10 fingers for 365 days in the calendar year. Now you want to detox in 1 day or in 2 days. I don't even know where they got this word detox from. All these ones are University of social media, kind of. But I must tell you that what you do on a day-to-day basis, whatever you do, whatever you eat, whatever you drink, your up and down on a day-to-day basis is part of what makes you. And that is part of what makes the kind of disease that individual is even going to get, other than or develop, other than what we call inherited or genetic traits that are there lying dormant. But if your lifestyle, is such that the individual will develop a disease that has not even been recorded in the family before, that individual will develop it because we have what we call mutations, and that comes in even in form of food. What we eat, it's what makes us, and therefore you eat on a day-to-day basis. It makes you. It makes you. It's not detoxing of 1 day or 2 days in 365 calendar years that makes you, or that eliminates you. So coming to feeding, food, we consume all forms of things, but there are 2 major types of categories of food that we have all over the world. One category eliminates what we call inflammation. Another category, promotes inflammation. all disease entities all over the world is categorized under inflammation. Say it. Cancer is inflammatory. Asthma is inflammation. Hypertension is inflammation. Diabetes is inflammation. Obesity is inflammation. All forms of diseases, they're all inflammation, inflammation, inflammation. And I can say that categorically that the food we eat either eliminate this inflammation that causes diseases or promotes inflammation that causes diseases. I don't want to go into details of inflammation because I know quite many of us might not be scientists here, but I can tell you that there is a food, or rather, there's an approach to feeding in preventing hypertension. And that approach was brought into limelight several years back, and that approach is called dietary approach to stop hypertension, what we call DASH diet. I'm sure Mr. Oghan mentioned it earlier on. Call that approach dietary approach to stop hypertension. DASH diet is the number one. And that approach is a daily basis. It's a cumulative thing. It's not what you say you want to detox in 1 day or 2 days or 365 calendar days. It's a cumulative everyday affair. And just like it, also by the WHO accredited, is Mediterranean diet, just like it. DASH diet or Mediterranean diet, they are well-balanced diet. But that diet speaks volume. It's a pyramid of diet, it's a pyramid, and under that diet is an approach. Under that pyramid, the base of the pyramid is what we call, starts with physical activity. The base of that pyramid, if you draw a pyramid is this, and that. The base is physical activity. Then, followed by drinking substantial quantity of water. Then followed by your vegetables, your fruits. That's the DASH approach now. Followed by your vegetables and your fruits. And then next column, followed by the likes of legumes, beans, or beans product, those ones that have what we call low glycemic index, that have low glycemic, and then followed by that are the likes of your quantity of carbohydrates, because you need it, your little bit of carbohydrate here and there, and those carbohydrates will be whole wheat. They are whole wheat. So your whole wheat products, in the terms of taking whole wheat grain, whole wheat items, then comes inside that, and then they on top, last but not the least, of the pyramids of this DASH diet, are little bit of fats, and they are really good fats, polyunsaturated fats, as you find in olive oil, olive oil, and the rest of them. So that is the pyramid. That is the pyramid approach to people stopping, and it has been known to work very well. What we are saying today is not a mouthpiece. We are not just talking because we want to talk. We're talking because we want to educate ourselves and the public, because that's what they tell us when we attend meetings, whether virtually or on site in Europe or in America. They tell you, go back home. But when we have a meeting at the WHO, recently we had a meeting on WHO obesity worldwide, and we were asked to go back home and educate the community. You need to make sure your weight is of adequate standard. So, and of course, it's from your diet. It's from your diet. No matter the amount of physical activity you do, and your diet is wrong, then your weight, your physical activity will not be important. So that is the approach to stopping hypertension. DASH approach, DASH diet, or Mediterranean, filled with lots of vegetables, fruits, greens. And don't tell me that, I don't want people to say that, oh, these things are expensive. They are not expensive. It's knowledge. It is knowledge. Once you go to the market, there's what we call leafy vegetables. We call it for green. Sorry to use Yoruba. That's green leaves, spinach, shoko, all these things. They are good. And when you are preparing them, prepare them with little oil, little oil, and things that are, and when you are eating it on your table, your plate should be green, a mixture of colors. A mixture of colors, lots of vegetables. I mean it. When you are cooking your rice, let it be much of either rice or brown rice, and then add a lot of this thing to the rice, cabbage rice. You know, so in that wise, you are eating healthy. So that is the approach to stop hypertension, the DASH diet, Mediterranean diet. Not that you want to stop hypertension by detoxing one day in 365 calendar days. It's a day-to-day affair. Thank you very much, Doctor.
Wow, thank you so much, Dr. Ali. That was very, very, very insightful. And I was just smiling all through while you were you were talking about detox and university of social media and the common things we hear and see around now, which has taken over people's minds. And
Yeah.
I was discussing with Ms. Oghan earlier, and I spoke about how difficult it is to change some people's mindset. They believe in some herbal concoction or some other things, and some people think, oh, because I'm doing exercises, because I always work out, I'm physically fit, I have my six packs, I can eat anything I want, which you obviously explained that everything, it goes hand in hand. And one thing I also noted was the DASH diet, very important, the dietary approach to stop hypertension. Dietary approach to stop hypertension, DASH diet. So that was really, really awesome. And I wrote something down. You said what you do or eat or drink or you're up and down on a day-to-day basis is what makes you and determine the types of diseases one could develop. This is aside the hereditary diseases, and that means our lifestyle is very, very important. You don't eat a bar, you don't eat burger for a whole year, then go on a 3-day detox. It doesn't work that way. It's a day-to-day thing. Thank you very much, Dr. Ali. So my first question, before we go to the published questions from our audience, I have a lot of questions though, but I can see we have a lot of questions people are asking, so I'll just ask one. How often should hypertensive patients visit a cardiologist or general physician for checkup? Because we have hypertensive patients that say, oh, I know my drugs already. All I just need to do is refill, just keep refilling. And at what point do they need to go for checkup? How often should they go?
That's a very good question, and it's really very nice for this audience. Now, a patient who has been anyone who has been diagnosed to have high blood pressure, first and foremost, you must be able to have a check in your house, what we call home monitoring, self-home monitoring. That is, you must be able to have what we call this the blood pressure meter, something like this, home meter, home run. We have home run, we have many of them. That you should be able to check your blood pressure the first thing on waking up in the morning. It can be just once in a week, or once in 2 weeks, or once in a month. That is self-help at all, because it's a chronic illness, or rather, I don't want to use the word illness. It's just a chronic condition, and it's for life. Treatment is for life. So you cannot depend on your GP and your cardiologist for your entire days of 365 days again. You need to help yourself by making sure you have this blood pressure check machine available in your house, should in case you are just nowhere where you can even visit your GP or your consult or your cardiologist. At least you have this available. You can easily check. It will give you a fair idea of what blood pressure you are running. And also, I always tell people, you can have 2 of these. Have one in your travel bag, have one with you in your house, or in a bag that you come in with on a day-to-day. So you can check in your office, you can check at home. So that is number 1, self-help. That self-help is very important. It's by the WHO. Then number 2 is how often do you visit your GP or your cardiologist? Now, the GP usually should you visit your GP once in a month or once in 3 months, depending on your advice by the doctor. The doctor will know, when to actually tell you come and come again. But the idea of refilling, the fact that we have been giving drugs by the GP or by the consultant cardiologist, and then you are now taking the drug every day without checking up. That is suicidal. sorry to use that word, you must go and check up. First and foremost, hypertension is progressive. It's a dynamic something. So you need to know what is your status. So therefore, even if you check once in 3 months with your GP or as deemed fit with a cardiologist, is good. Once in 3, 4 times in a year, every 3 months, which runs to like 4 times in a year, which is not bad. But as I said, depending on situation on ground, individualized treatment. Your cardiologist, your GP might want to see you more. If, for example, you have other conditions, diabetes, high uric acid level, and so on and so forth, that the doctor is compelled to also manage along with this high blood pressure, which usually comes along with it. So, but albeit, if everything is good, everything is going well, once in 3 months is ideal. Even sometimes I say, see me in 6 months' time. You don't need, or you want me to see my face, and see me in 6 months' time now. Just take your drug and check this, depending on the patient characteristics. So that's how I'm going to be able to. But for somebody to just be consuming drug without checking up at all is not the ideal situation. Thank you very much, Doctor.
Okay, thank you, Dr. Ali. Very explanatory, because we get that a lot. I'm sure you've met very interesting patients that just want their drug refill and they don't want to come back. But like you said,
I refuse them. I say, I'm not going to refill. Next time you come, don't come and ask. Don't call me to say you want to refill, because I will not even pick your phone. Once you tell me that you are coming to, please, Dr. Ali, send my drug, I will tell you, I didn't pick your call because we already agree that you have to come in principle. So we put that on our feet like that and say, you must come this time around. Let us evaluate you. Thank you.
Okay. Thank you, Dr. Ali. My next question, well, I'll be taking the live questions now, because I don't want to be so selfish with my questions. Someone wrote, Abayomi wrote, can someone stop using high blood pressure drugs after some time when the BP is normal, or will it be taken till death do us part, like marriage pledge?
That's a nice question. Okay. Are you through with the question?
Yes, ma'am.
Okay.
I am.
By the researchers, ideally, high blood pressure medication is for life. Yes, till death do us part. It's a marriage ceremony, because it is well documented that as you grow older, the blood pressure also gets higher. So that is dynamism number one. As you grow older, blood pressure goes higher. You understand? In the management of blood pressure, the medication we are giving is a suppressant. It's suppressing the blood pressure. Once you remove the medication, the pressure gradually climbs up. None of the medication is curative. They're just controlling the pressure. And once the blood pressure keeps going up without being checked, then the person is liable for complications, preventable complications. So it's for life. Albeit, again, there are some situations that can arise. But don't let us get into the argument of situation. But let us just know that treatment of blood pressure is a marriage, is for life, if the individual wants to stay alive and well. Thank you.
Thank you, Dr. Ali. Straight to the point, very explanatory, and a funny question too. The next question, there are 2 questions, but I'll merge them into one. It says, is taking BP drug, does taking BP drugs have any significant effect on man's ability to make love, or leading to erection dysfunction? And it is having regular sexual intercourse. Will having regular sexual intercourse help in reducing high blood pressure? So 2 questions. BP drugs, does it affect the manhood? Regular sexual intercourse, does it help with BP?
Okay. Thank you very much for that question. My patient often asks me these questions, and I am very point blank. Number one, with regards to medication and men's libido, yes, medications for treating high blood pressure do affect libido. It is well documented. But I can tell you that there are some of them that are very gentle on libido. Some of them, practically, they don't cause reduction in libido. But there are some that are classical libido, reducer. So we tend to again individualize patients in what we choose, as with regards to, for example, I would not want to give a man Aldomet, alpha methyldopa, because I know that that one is a libido killer. You understand? So, but I would rather shift to a drug that we first control the blood pressure and we not cause any side effects for my patient. That is, it will be highly tolerated by. So I will tell them, sir, ma, we're on a journey. And the journey is that we're going to have to select a drug that is best for your system. It will not reduce your libido. It will help me to control the blood pressure very well. All we need to do is we take the drug and we check the blood pressure. Blood pressure is normal, and you are going about your normal business, because this is a lifelong thing. It has to be a drug that is comfortable for you. It has to be a drug that you are looking forward to take tomorrow, next tomorrow, next tomorrow, because you know that when you take it, your blood pressure is normal and there's no intolerant side effects. So that is how, yes, there are drugs that reduce libido. Albeit, let us also know that turgidity, man's erection is also depending on blood vessels. So therefore, the disease entity itself, the state of the disease itself, can even lead to atherosclerosis, as you and I know, and worsen man's libido. So it is a circumstance situation. Where I come to the point, I stand on one point. It is when you are alive that you can think of libido. When a man is no more, can he think of libido? So, my dear brother, let us sort out this blood pressure first. You understand? And then we'll now come to term with libido. And I will tell you that we get here, it is a journey. Thank you very much. The next question is whether sexual activity helps blood pressure. Of course, sexual activity is a form of activity, and it can itself reduce blood pressure, provided that it is done at a pleasurable event. It's not enforced. You are happy, many of the things we do as humans, they work on our system, sympathetic system, parasympathetic system, are stimulated from time to time. So if you're under stress, under duress of having to meet a woman, then you are going to incur a lot of injury to yourself. But if there is a jolly friendship, or partners who are happy with each other, there is no problem, there is marital bliss, then to God be the glory. There is it will reduce blood pressure, it will make satisfaction of life, and then your mental health, physical health, they will all be okay. Thank you very much, Dr. Obukoya.
Okay. Thank you, Dr. Ali. I have more questions. I have a lot of questions here for you, Drew, but I'm trying to prioritize so that I can also take questions from Ms. Oghan. And I can see some questions here. Some people are asking about some numbers. I don't know if this is the right place to talk about BP numbers and expatiate. I think it would be best for you to go to your primary health physician, and if you have to see a cardiologist, go to a cardiologist. Or do we take them? Do we take the numbers? Should we take the number question?
Let's just briefly take the numbers. They are asking that which one is high blood pressure, which one is normal blood pressure.
No. This person, they are specific. One wrote, I was on borderline of 145 for more than 6 years, only for me to work on my sugar level, and after being normalized, I discovered that my BP dropped to 116.72. Another visit was 116.72, and recent one was 125.65. What could have happened?
Okay, which means his blood pressure was 145 over whatever, yes, for a long period of time. And then was he on medication or not? I couldn't get the question very well. We don't know whether he was on medication, or possibly he wasn't on medication, but it appears that this patient also have diabetes. because he said he was working on his sugar level, or maybe he's pre-diabetic, or maybe he's pre-diabetic now, and he wants to find out his blood pressure has dropped to 116, or it's now 116/68, or 116/70, which is super good. Now, concerning his case, that is why I'm saying management of high blood pressure is individualized. Don't say what that person is taking is what the next person is going to take, because the constellation of individual differs. Now, if this patient in question, this person is questioned, have high blood pressure, have pre-diabetes states, or abnormal blood sugar metabolism, then what it means that he has a double risk factors on his organs, the brain, the heart, and the kidneys. So at this point in time, he will benefit from whatever small drop of blood pressure, and that can bring that blood pressure down to that level, because he has a double risk, double tragedy. That's double risk, diabetes and high blood pressure. So he must have something to help his blood pressure. Otherwise, these two conditions will rapidly progress to kidney failure, or to any form of arteriosclerosis, heart failure, or even a stroke event if it's not managed properly. Thank you for this individual.
Okay. Thank you, Dr. Ali. Thank you, Dr. Ali. I'll take 2 more questions with you before moving to Ms. Oghan. So one question says, what do you do when the systolic pressure is usually over 120 but lower than 140, and diastolic pressure is over 80 but lower than 100 despite taking regular hypertensive drugs?
Well, it simply means that the patient is not controlled. It's not controlled to targets. Systole lower than 140 but above 120. Diastole 80 but below 100. It simply means that it's not controlled to target. The WHO has a target for every adult, and that target is 130/80 and below. So when you begin to shoot out of 130 systole and shoot out of 80 diastole, then it means that you have not reached the optimal targets. There are targets for all of them: diabetes, blood pressure, cholesterol, weight, and on. We have optimal targets for them. And that is what we are talking about when I introduced this condition, that majority of people who have high blood pressure in Africa, sub-Saharan Africa, majority do not know. They are not aware. Out of the few that are aware, majority are not controlled to targets because of misinformation. Controlling to targets is very of the blood tissues, of the tissues of the body to be well orchestrated, without any situation whereby the blood vessel or the tissue are under a lot of duress of stress. So it has a standard to all this management. So obviously the person needs possibly to shed some weight, possibly to eat right, possibly to lower your salt intake. May not even be necessary to even increase the drug. May just be some lifestyle optimal targets. Thank you, Dr. Okoye.
Okay. The last question, but not really the last. I'll merge 2 questions again together because there are so many. Is white coat hypertension hereditary, and how can it be stopped? I have normal pressure at home and elevated numbers once I am into the hospital. Oh, and the second one is, what are the types of hypertension?
Okay, thank you very much, the person who has given this question. White coat hypertension, or rather as we call it, is a form of situation. It's situational, because you said when you say that when you come into the clinic, when you see white coat as I'm wearing one like this, or when I carry the stick and I want to measure your blood pressure, then it goes higher. It is a well-known entity. Now, what we tend to do is to find out, does this person really have white coat hypertension, or genuinely has a white coat hypertension, or as what we call formed high blood pressure that is not related to white coat. Therefore, we need to do 24-hour blood pressure management, monitoring for that patient. Patient will carry the monitor right from the hospital, and then you go home, ambulatory. You go to your house with the blood pressure cuff to be recording on the meter. There's a meter attached to it. So it will now tell me that, okay, it was only that time when you were in the hospital that your blood pressure was high. When you were in your house, when you were in your office, when you were eating and drinking, all your blood pressure was normal. Then I will be able to categorically, evidence-based, science, categorically say that, yes, your blood pressure is high white coat hypertension, and really there is no problem. So you just need to manage it. Now, whether it's hereditary or not hereditary, it might be, but it's constitutional, because I can say that constitutional because some of us, individual differences, the way we react to this differs. Some people, they can keep their sympathetic system controlled. Whether they are in the face of any form of any problem, they are well controlled, right to inside. Some people, once they have any form of aggravation, it aggravates their sympathetic system, and then the systolic blood pressure goes up. So it is constitutional. I rather use the word constitutional rather than hereditary in terms of white coat hypertension. But you must be able to diagnose it. Diagnosing meaning you need to do the 24-hour blood pressure monitor to be able to tell the clinician, evidence-based, that, oh, it's just constitutionally having some systolic sympathetic elevation when it's under some duress, and therefore you don't have to worry about it. But by the time you do it, and we will find that even when you are sleeping, your blood pressure is high, then we know that it's not a matter of white coat hypertension, it's a matter of established hypertension. Thank you very much.
Thank you, Dr. Ali. Thank you very much. Thank you very much, Dr. Ali. Thank you very much, Dr. Ali. You always explain it very well and in a very simple way. So I'll take some questions for the dietitian before you give us at least you have to give us parting words and still tell us one or two things before we go. So please don't leave us yet. Okay, so I have some questions for Ms. Oghan. Someone wrote, "Do let us know the quantity of salt someone can take, someone without hypertension can take in teaspoon measurement." I know you spoke about some standard measurement, but they want to know in teaspoon measurement, as in how many teaspoons full can someone take. Another person wrote, what if you have diabetes? What type of fruits can you take? I know you explained this earlier, but these are just follow-up questions.
Okay, so for diabetes, you can actually take most fruits, apart from things that have high glycemic index, meaning things that have the ability to raise the sugar level fast and have the fiber content is low. Examples of those ones are things like pineapples and mango. Now, you can still take those ones, but you have to match with something that is fiber dense. So if you must take pineapple, for instance, there's an amount that we would calculate for you to take, and then you match it with something like cucumber, have it like a fruit bowl. Now, you can take every fruit, like I said earlier, but they are all measured. So if you're going to have an apple, you would have one medium apple. You can't have rather a fruit bowl that comprises of different kinds of fruits. So everything has to be measured. If it's purple, it has to be one slice. If it's watermelon, one slice as well. For grapes, about 8 pieces. So you can have most fruits, but within a particular amount. And those quantities actually vary from person to person. Now, the fruits that you can have liberally are basically your vegetables. Things like cucumber, garden eggs, lettuce, cabbage, walnuts, things like that are very abundant in fiber, are things that you can have as you like. But every other kind of fruit has to be measured. So for sodium, for sodium, I mentioned that if, for instance, you're just trying to make sure that your blood pressure doesn't become elevated or anything like that, you can have about 2,300 milligrams. That's about a heaped teaspoon, or let's say a heap, 1 teaspoon and a half maximum. If you are hypertensive, that's about 1,500 milligrams. So that's, let's say, half a teaspoon thereabout. That's the added sodium or salts that you can add to your food. And also remember that I mentioned other ways that we get sodium. We can get from our seasonings: ginger, soy sauce, crayfish, and some fruits also that have potassium that help the heart also have sodium present in it as well. So for added sodium, those are the quantities that you would add.
Thank you, Ms. Oghan. So I will take one last question before we round up, before Dr. Alli rounds up. The last question is, for someone that doesn't really take alcohol, is it safe to take soft drinks without control?
No, it is not safe to take soft drinks without control. These actually give healthy, empty calories, and an accumulation of all these can make a person become overweight or develop other things that can now lead to hypertension.
Okay. Thank you for that. So yes, thank you, Ms. Oghan. So taking soft drinks without control is a no-no. Yes. I know it's a hard truth, but we just need to accept. And I think it's a mindset thing generally. Once you see it as you're being punished, some people think when they have to go on a diet, they see it as punishment. Just see it as a day-to-day lifestyle. Though it's very difficult. I also know the things I like. And when I saw your slide about noodles, I was just frowning. But these things need to be done for us to live a healthy lifestyle. Thank you very much, Ms. Oghan. So I would like Dr. Alli to give us some parting words and some parting words before we round off. So thank you, Ms. Oghan. So now it's time for Dr. Alli to give us some parting words before we leave. Thank you so much, Ms. Oghan, for your answers.
Thank you.
So Dr. Alli, over to you.
Can I talk now? Yeah. Okay. To take home, because I always say that when we sit down like this and we discuss about high blood pressure, hypertension, there must be a take home. There must be a take home. Something you must remember from what we have said so far. A take home that we inform is an information that we impact everybody's day-to-day, life activity. Everybody, as I said earlier, is what you do on a daily basis. It's what you do. It's a cumulative effect of what you do on a daily basis to your body. So the take home now is this: number one, on a day-to-day basis, ask yourself, am I even okay? Because absence of symptoms does not say that there is no problem. As we said earlier, high blood pressure is symptomless for several years. It could be available for several years, without you knowing. So therefore, knowing your numbers, asking yourself, is my blood pressure normal as I am now? Is my blood sugar okay? Every one of us, including Dr. Okoya, that is moderating this thing, everyone, you will need to ask yourself on a day-to-day basis, is my blood pressure normal? Is my blood sugar okay? Is my cholesterol normal? Just ask yourself simple questions. And then if you know that you cannot even lay hand on any of these things, then please go and check your numbers. That is take home number one. Then take home number two is the fact that what you eat, what you and I eat, contributes to our health. And as I said earlier, what you eat contribute to the kind of disease, what you drink, contribute, or what you smoke, contribute to the kind of disease you are going to have. It's a cumulative event. So why don't we eliminate many problems now? Like I used to say, in the year 2020, we have the meteorologist. When everybody was given sit down at home, we all sat down at home. The meteorologist went into the air. They sampled the air. You understand? They sampled the air, and they found out that the air was 100% purified when you and myself were locked up in our houses all over the world. 100% purity. When I saw it, I was amazed. But as soon as the lockdown was over, the meteorologists went back. They took samples over China, over India, over Africa, over Europe, over America, and they came out with numbers. They have discovered that, in fact, the worst was that the impurities, the air pollution over all these eastern countries was so high that as much as 90%, something that was 100% purified few months back, now 100% almost unpurified. So you can see there are many things. This COVID has even taught us one lesson. There are many things that we don't see on our day-to-day activities that are affecting our health. The microorganisms you don't see are there. The impurities in the air you don't see are there. The impurities in the food you eat are there. Every kind of things are there in the same body. So therefore, I will say number 2 take home is that know what you are doing. Be conscious. Carry into your consciousness what you eat on a daily basis, what you drink. You can't go to the supermarket and see all those beautiful pink, blue, red display and not read the literature. Just look at the literature. Some of them will say zero fat, 90 sodium percent. You know that you are consuming a lot of salt already. You don't even need nutritionists to tell you to take half a spoon. By the time you buy something that is 0 fat, 0 protein, 90% salt, is that not already telling you are consuming salt? Excuse me. And this is the kind of things we are talking about. Be coming into your consciousness on what you do to yourself. The food you eat, the water you drink, the quantity of the hours you sleep, the amount of smoke, generator fuels, mole fumes, all kinds that you expose yourself to. They are part of what you make yourself. At the end of the day, by the time one is retired, and you find that, oh, I remember one matron that retired at the age of 65, and the thing we discovered at UCH, then University College Hospital in Ibadan, she came down with cancer of the lungs. You understand? At retirement. So we need to be conscious of what we do to ourselves on a day-to-day basis. And I think on that note, if anything, is that take your drug. If you have been known to have hypertension, check your numbers, do what is needful. Don't leave things into the hand of, Shebi, I'm seeing doctor. Or Shebi, am I not seeing doctor? Am I not? No. Take your life in your hand and do what is needful. And of course, with God on our side, we get to the right page. Thank you, Dr. Okukwe.
Wow. Thank you so much, Dr. Alli, for taking our time to educate us. Thank you so much. My notes are filled. I've been writing and writing and writing. Thank you so much for taking our time and for your insightful words and advices. Know your numbers and watch what you take in, what you eat, what you drink, what you smoke. You know, some are even secondary smokers and they don't know. Thank you so much for that. And thank you, Ms. Oghan, for also taking our time to be with us today. A lot of people didn't join from the beginning. They asked if we are going to have this recording. Yes, the recording will be on YouTube next week, so you can check our page at Avon HMO. You can also subscribe. And thank you so much, Lagos Executive Cardiovascular Center, for honoring us with Dr. Alli and Ms. Oghan for this beautiful time. So we've come to the end of this webinar. And I would like to say, everybody enjoy the rest of your week. Happy weekend, everyone, and take your heart seriously. Dr. Alli said, your heart is in your hands. Like literally, take it personal. Don't depend on doctors only. Also, be very mindful and be very take your life personally. Be very personal with your life. Thank you so much once again, and do enjoy the rest of your weekend. Bye, everyone. Bye, Dr. Ali. Bye, Ms. Oghan. And the video will be available on YouTube. It will be posted on our social media platforms. You can see them next week. Bye, everyone.